Hi guys, I just wanted to give some insight onto an MRI scan that I had on Boxing Day. Hopefully this will be of interest to you. I had some abnormalities. So I have grade 2 chondromalacial patella, which is a wearing down of the cartilage, and I have what they described as a subtle tear of my medial meniscus. And the physio's advice is basically this is not too serious. It's pretty common, and that I should still be training, but obviously like adjusting as needed. And I want to just talk a little bit about MRI scans. So sometimes people get injured, and the first thing they do is like, okay, I've got to have an MRI scan. And I don't think that's always the best thing. Sometimes it can obviously be important, but the issue is that there's a lot of people walking around with zero pain that are going to have something abnormal on the MRI scan. So, for example, they looked at people with no lower back pain, and they found 30% had some sort of like disc injury in their lower back. And then a study that I looked at a few weeks ago, they looked up asymptomatic knees, so no pain, and they found that 97% had some sort of abnormality like show up on the MRI. So sometimes what happens in the MRI, it could just be an injury that happened like 10, 20 years ago. It doesn't always mean that this is what's causing the pain. And it's perfectly possible to have kind of abnormalities, but have your knee functioning very well. So my knee's feeling pretty good, really. The scan was only 3 weeks ago. And I've been training. I've been steadily getting stronger. I did a leg day today. I wasn't the strongest, but we're getting there. So just something to think about, that because the MRI it doesn't actually change the treatment. In most cases, you should do the physio first, like the kind of like the therapy, because that's often going to be very, very effective for injuries in most cases. And then as a last resort, you go for surgery. Your mindset is very important. They found people that believe that their body's going to recover tend to recover better than people that expect the worst. So yeah, you have to be positive. I'll give you like just a backstory actually with someone that I trained. So she ended up like hurting her back. She went for an MRI. She found a bulging disc, if I remember rightly. And I kind of told everything that I'd say here, that the MRI probably doesn't say much, but you've got to be careful not to try and like push like too much info and just tell them that like, oh, this is not important. Like, we've got to work with people. The strategy was like, yeah, we did the kind of like the rehab, like lots of core work. We just like deloaded it, because most cases the injuries are going to heal by themselves. And what we did when she got back, because we had to do something to kind of get her back strong, we can't just like leave the lower back and not do anything with it. Like, that's going to be worse. You're going to be more likely to injure yourself. So we kind of built her up, and I capped her at a 30-kilogram deadlift. And she did this for like a few weeks, few months, and I just said, look, when you're ready to move up, you say. And I remember her saying like, no, I don't feel confident. She didn't think she'd ever move up, but after a few months, she kind of got stronger. She found it was easier, and then eventually she had the confidence. She was like, I'm ready to move up. So you just have to be patient, and definitely if you get an MRI, it's more kind of like ruling out what the injury isn't. And the reason that I got it is that I've got a history of like kind of arthritis in my family. So I want something to compare in the future. So I've got an MRI now. I'm 35. And then 10, 20 years, if I get another MRI, I'll compare it with today to see how it's changing. And then that will kind of like change what I do. All right. So I hope this is useful for you guys. And yeah, I'm feeling strong. I'm feeling good. And I'm definitely going to be hitting some PBs this year.